All right, well, good morning, everybody. Thank you all so much for coming. It's our pleasure to be here to talk about the partnership that our state has developed with the community health centers and federally qualified health centers in the state of Connecticut. And here we are on day 2 of phase 2, and our message is simple. In order for us to successfully reopen the economy, we need to make sure that everyone in our state has easy access to COVID-19 testing. And we want everyone in urban areas, vulnerable communities of our state to have easy access to testing, whether it's by car or just to walk up. And so earlier today I was in Waterbury at a mobile testing site. The governor and I really want to highlight that it's important to get tested. We know as people begin to go back to work, because now 95% of our businesses can be opened, and people are concerned if they're employees, they want to be safe when they go back to work. Employers want to make sure that their workplaces are safe for their employees. So our message today is very simple: get tested. It's free. If you have insurance, the insurance companies will pay for the testing. If you don't have insurance, don't worry. The test is free to you. And by the way, if you come to the community health center to get tested and you don't already have a trusted relationship with the health center, you will be welcomed. It'll be a great place to get your flu shot in the fall when you need one, and they can help sign you up for Access Health Connecticut or other health insurance programs if you need it. In Connecticut, we're so grateful to have the community health centers. They are trusted partners in all parts of our state. So we want everybody to know it's important to get tested. If you have symptoms you think, or you're worried you might have COVID, get yourself to a testing site. Don't worry about having to pay for it. And if there's a very small possibility that you do test positive, this is a way for you to get help. You don't need a doctor's note. You don't need a doctor's order. Just come right in. There's so many convenient testing locations. The community health centers have been just a vibrant and important part of our state, and it's my pleasure to introduce Yvette Highsmith. Yvette and I are both Middletown girls, born and bred, and Yvette has been a leader of this health system here in New Britain, and she's going to talk about some of the programs that they are providing here, both for testing, and she'll also talk about how we've partnered with the health centers to do mobile testing with the help of the community health center. So she'll be talking about how the health centers will be serving our urban areas and vulnerable populations. Yvette.
Thank you so much, Lieutenant Governor, and to Governor Lamont for both of you and your extreme, passionate, committed leadership across the state in these unprecedented times where we find ourselves living in dual pandemics and faced with the challenge of yet again another illness that is disparately impacting communities of color. Our ability to provide access to testing in the neighborhoods where people live, densely populated neighborhoods that house and support our essential workers. This is an absolutely critical step to ensuring the continued safety of health and wellness of all Connecticut residents. Community Health Center, Inc. is a statewide federally qualified health center. We are pleased to be the primary care home for over 1,000 Connecticut residents. And one of the benefits of accessing COVID testing at federally qualified health centers is that individuals find out not only can they get their test and their COVID test results, but they also, if they're not our established patient, discover that there's a gem of a resource in their communities of a health center that can provide access to medical, behavioral health, and in our current environment, emergency dental services. Under the leadership of our CEO and president, Mark Maselli, we were able to make a quick pivot to telecare. And so at the end of March, we didn't close our doors to our patients. Instead, we were able to support them as we usually did, and some in an improved manner using telecare. So we did not skip a beat in ensuring that our most vulnerable residents still had access to the services that they needed. And particularly in the midst of this pandemic, we found that behavioral health was something that I think we could all say we all needed. And so for our patients who were established with us and who already had a relationship with a behavioral health clinician, that was able to continue and to increase in some instances. And for those individuals who were not established with us, we were still enrolling new patients and still do to this date. So being able to provide that continued access and support with the regulatory changes, and the governor and I were chatting a second ago, those changes need to remain in place. Our families and our communities that are vulnerable, we should no longer have a system that works for the haves and doesn't work for the have-nots. We need to have consistency in access across the state. With our testing events and activities, you can see that this is a highly visible, high traffic area. We're able to serve everyone who comes out, but we have also deployed mobile testing teams where we partner with collaborative partners across the state to bring testing to where our partners are serving Connecticut residents. As a federally qualified health center, this work that we've done, we've never done it alone. We've always had well-established partnerships to ensure comprehensive care. And so it was very easy to transition to ensuring that the COVID testing was also a part of those collaborative relationships. So we, again, encourage folks to come out, get tested, be a part of the safe reopening of the state so we don't find ourselves like other countries and other states experiencing a resurgence or spikes in new cases and infections, but also continue to take care of your general health and wellness. COVID has not removed the need for children to be immunized. We have set up immunization clinics that mitigate risk, and we are able to ensure that our families are coming into an environment that, again, mitigates risk and exposure and heightens and emphasizes safety, but also individuals with diabetes and hypertension and cardiovascular disease still need care, and federally qualified health centers are here and willing and able to support you. So thank you, Governor. We appreciate your continued support.
Yvette, thank you so much. It's now my pleasure to introduce a medical doctor and also state representative, Dr. Pettit, and his intern.
Thank you, Lieutenant Governor. Thank you, everybody, for coming out on a hot day. I'm sure you'd all rather be at the beach, golf course, swim pool. Testing remains critical, and I'll direct this first at the people in 22nd. I represent New Britain and Plainville. You can get tested here at the Community Health Center of New Britain. The Lieutenant Governor and I last week were at AFC Urgent Care. You can get tested there. The Wheeler Clinic does some testing, as do the CVS. If you have symptoms or you're concerned, you should get tested. William III here got tested. He was not happy about the test, for sure, but he said it didn't hurt, and he was, thank goodness, negative. I think there's less motivation for people to be tested, given the fact that the numbers in Connecticut have fallen, and we're one of the half a dozen green states in the U.S. But remember, even though we're below 200 for total hospitalized with COVID, and we've been under double digits for deaths, and I think you all know it, those are statistics, but one death to the people involved, that's a tragedy. So every death we can prevents a tragedy. So appropriate testing and follow-up still makes sense, and we've tried to make it widely available and easy for folks to do around the state, not only in the 22nd district here. So I thank you for the services that you provide, and though you didn't talk about specifics, I assume you're doing the PCR testing for active viral infection, antibody testing to see if people have positive antibodies, which are two different tests, and people can discuss it when they come in to see which test they need. So I thank everybody for getting the word out that testing is still critical. And I'll just end with the simple things make sense. The masks that you're all wearing, social distancing, hand washing, and as we're seeing, there was a great review article in the Wall Street Journal. All this knowledge has evolved, and a lot of people complain about mistakes that are made or misdecisions, but we didn't understand how the biology of this virus when it first came out. We didn't understand there was a 2 to 14 day pre-symptomatic incubation period. So the simple things, so avoiding tightly confined areas with where you're in a small area with contained airflow is an issue. So being outside is great. Having your mask on is great. A lot of hand washing and social distancing will take care of 90% of the problems that we have. So thank you for inviting me. Thank you, Lieutenant Governor and Governor. And William, I had to explain to him all these people are, and he sort of wanted to know who in your group was in charge of food.
There you go.
None of us.
No, thank you so much, Dr. Pettit. And I think it's really important to point out another reason to get tested is there are so many asymptomatic people who could be carriers for COVID. Yet another really important reason to get tested. That's why the governor and I have both been tested to get the message out to everyone. And with that, it's my pleasure to introduce our great governor, Ned Lamont.
Well, thank you, Susan, and Dr. Pettit, thank you, and William Mookie Betts Pettit, you'll be there in the Red Sox uniform sometime. Look, Yvette, first of all, let me just say we love what a community health center does. A community health center brings good, comprehensive health, no questions asked, no cost to the people. And that's what the Community Health Center of New Britain does, and community health centers across this state. And a special shout out to, I think you're known as Dr. K. Do I have that right? Dr. K is a lot friendlier than that face shield may let you know. But Dr. K is here. We've got the testing available. We've got lots of testing capacity. And as Bill and Susan both said, New Britain was hit pretty hard. New Britain was hit pretty hard, Dr. K, by the COVID virus. And yet we're only 50th in terms of testing. So it's here, it's available, it's no questions asked. Dr. K will be happy to take care of you, and you can drive right through. And by the way, while you're driving through, you can also get a vaccine. You were just mentioning to me, isn't that correct? An immunization. You can get an immunization. And that's really important as well. We've got another flu season coming up in the fall. We're trying to make that easier for you. Look, a lot of basic primary care has been put off over the course of the last 3 or 4 months. People have just been a little anxious about coming in. There's no need to be anxious. It's available. It's right here. And as Yvette pointed out to me, the other thing we've learned a lot more about over the course of this pandemic is telehealth, and how it's easier and easier for you to get a basic conversation with a doctor or a primary care doc, either online or by telephone. So we're doing everything we can to bring the health care to you, but it only works if you open the door and reciprocate. Obviously, what testing means in a town like this, it means not only you know you're safe, but your neighbors know they're safe, your family knows they're safe, and if you do test positive, we can keep them all safe going forward. So it's so important what we got to do. So Yvette, thank you to you and your whole team. And just in case you don't know, Josh Jabal, who's been leading our COVID effort here for some time, is quietly in the sidelines. That's it. Where'd you go, Dr. K?
All right, questions?
Governor, can you explain to us why the change in policy regarding nursing home testing now, according to your order last night, if there's no positive tests for 14 consecutive days. There'll be no longer any required staff and resident testing. Is that correct?
Yeah, I'm going to start, and Josh can take this. But Paul, one of the things we know how tragically hit the nursing homes were. We got there early in terms of a lot of the basic protocols, especially in terms of visitations, in terms of testing. But we are now in there testing every single patient, testing every single nurse that's there, doing that on a regular basis. We have more testing capacity than we had 2 months ago. There's no question about it. And we get a faster response. You know, 2 or 3 months ago, it would take 3, 4, 5 days to get a response from that lab in California. And by then, an infection can spread. Anything else, Josh?
Yeah, just on your specific question, Paul, it's just to completely align our state policy with the guidelines from the CDC and also the Centers for Medicaid and Medicare Services, which recommends that if you have a facility that tests completely negative, both staff and residents, for 14 consecutive days, then the repetitive testing is no longer required. If you do get another negative case or a positive case in the facility, though, then the whole regime resumes.
So then you would have to. How many? The orders specified that testing the staff start on June 14th. Do we have any information on how many nursing homes? I mean, I realize it's only a couple of days. But.
Yeah, but we, as I think you know, we've been testing in nursing homes now for several weeks. We report that data and the results in our data package every Thursday, so we'll have an update on that in our package this afternoon. And now we're setting up now this weekly repetitive testing that's already started ramping up across all the facilities across the state this week.
Do the nursing homes have the ability to separate people? I mean, so if someone is tested positive, I know that was an issue early on. I mean, how do you keep them away from others? How is that being addressed?
Yes, this is fundamental, critical importance of infection control in our nursing homes. And so most of the homes have the capacity to do that, have been doing that. This is a key part of the inspections that our DPH and National Guard team have been doing. Wherever there's a case where they can't do that for whatever reason, that's why we set up these alternate COVID facilities as well to provide overflow capacity where it's needed. But fortunately, we're in a position now where most homes, the infection rates have gone way down. They're in a much better position.
And the other question I had, now that family members are able to see their loved ones, how is that going? I know it's outside only, but what protections have they heard that it goes as well?
Yeah, that's increasing in a number of facilities around the state too. As you said, outdoor visitation. It's an incremental challenge for the staff in the facilities to be able to carve out the time to do that. Some of them haven't gotten there yet, but we're working with them, trying to make sure that that's happening. It's critically important. You can be sick from COVID. You can also be incredible health impacts from not seeing your family, being isolated in a room for 3 months. It's heartbreaking, and we're really working with the homes to try to make sure that that's increasing as well.
It did give the nursing homes, though, immunity from civil lawsuits in an executive order, and some of the law firms have actually started advertising campaigns now asking people if they have loved ones who were treated poorly to contact them. So are you considering rescinding that immunity?
Look, we're taking a look at it, but at the time, and we did give them a protection from lawsuits going back, I think, a couple of months. We did the same thing for the hospitals. As you know, with the pandemic crashing on us like a wave, we are working closely every day with the nursing homes, setting up COVID-only nursing homes, a lot of back and forth. So we thought the immunity was appropriate in order to allow people to respond very quickly. At the same time, gross negligence. At the same time, we still regulate. At the same time, we can still fine people. And we'll take a look at the immunity thing as well.
I also just wanted to ask you, how do you think phase 2 opening day went? Do you have any specifics on businesses that might have been forced to close or were cited or were warned for anything?
Well, I met with the head of the Restaurant Association yesterday, Dan, and he says he thinks overwhelmingly the rest of the restaurants got going yesterday or at least this week. And they really wanted it in time for Father's Day, which I appreciate. And I think so far the protocols were handled very scrupulously, and I think we're probably in a very good day too.
Any specifics, though, on the citations or the warnings?
I don't think I have any warnings on that as yet, no.
The liability issue, are you talking about an executive order, or are you talking about changing state law?
No, if I did it, I'd do it by executive order, just the same way we did it. It all ends in September anyway.
Governor,
comments yesterday about not wanting another round of $600 federal unemployment help, but that seems to be completely opposite to what the Connecticut congressional delegation wants. Would you comment on that, please?
Well, what I said was, rather than a $600 true-up, what I really would appreciate is them making a grant to our unemployment compensation fund. As you know, during our first year, we got a couple $100 million extra into the fund, and that was really important. But that just bought us an extra few weeks, given the nature of the unemployment claims. So if I was recommending to the federal government, I'd say, rather than the true-up right now, make it a grant, not a loan, to our states. This is true of 50 states across the country. That would allow us to keep unemployment taxes low, and we'd still have, of course, our unemployment claims for everybody in need.
Governor, that $600 for a lot of people has been an absolute lifeline. What do you say to the people who won't be able to pay their rent or won't be able to make it on state unemployment comp alone?
Well, we've got the state unemployment compensation. We've opened up 95% of our economy. We're urging everybody we can to get back to work. You've got another month, and now's the time to plan for that day that you get back to work, now that all the stores and businesses are pretty much open. Maybe wait 1 second. We've talked to a few folks in the legislature about that. We'll take a look.
What are the prospects of that happening, or what are the considerations there?
See what the appetite for that is. Is that we're losing a day of work. We got Martin Luther King Day. But really, given George Floyd, we know this is a special time to pay attention to racial justice. Susan?
Or perhaps we could trade it for Columbus Day.
Governor, the jobs report for May came out. It shows a gain of 25,000, I think 200 jobs overall, 30,500 jobs gained in the private sector, but we still had a record 269,200 jobs lost in April, and the May numbers are still down 223,000 from May 19th. Your thoughts on this? Is it a sign of recovery, or a sign of recovery?
I think people are slowly getting back to work. And we're doing everything we can to make it easier for them to get back to work. We're providing, free training certificates for everybody on unemployment right now. Give them an opportunity. Right now, as we speak, we have the online jobs fair at no cost with 60 employers, all looking for employees to go online there. Our great hope, Paul, is that I know everybody's not going to go running back to the indoor restaurant or running back to work, but we want them to be able to walk back at their own pace, but be able to know that they got a job there. We're ready for them.
You've talked about allowing wine to be sold in grocery stores. Do you have any update on that, or what the pros and cons are of that?
Yeah, we were at the winery yesterday. They brought that up. I said it's something we'll look at. Let me talk to the legislature about that and see where they are. I know many other states have done that already.
Governor, I know pools were part of the phase 2 reopening, but the weather's about to get pretty hot. Do you have any, are splash pads going to be a part of that? State parks, where can people go to cool off, and are you concerned about social distancing?
Well, I'm always concerned about social distancing, but I'm proud of Connecticut because they have kept up their guard throughout. As you know, we never closed down our beaches, unlike our neighbors. We never closed down our state parks, unlike our neighbors. And now, as you point out, our pools are opening up. So I think it's a good time to do it. Watch out of pools. You can be close in and keep your distance. I think they are. I got to check that, though.
Governor, in terms of how you can restart the economy's best, do you think that a person who is on unemployment and getting that $600 in federal money as well is likely to spend more and do more for the economy than somebody who goes back to work for a minimum wage?
There are a few other ideas out there, one of which is we'll pay you $450 when you go back to work. That's a plan that's circulating around the House and Senate as well. I'm doing everything I can to encourage people to get back to work, make sure that they can do it safely. If they can't do it safely, if they don't feel like they can do it safely, they'll be reluctant to go back.
Well, you didn't really answer my question. Do you think that giving them another $600 to spend in the economy, rather than going back to work at minimum wage, would do more for the economy than them going back?
I think I did actually answer. I said one of the other ideas is we'll pay you a stipend when you go back to work, to go back to work. I think it's $450 is the current plan.
And you support that?
I think that makes a lot of sense.
What about for people who have underlying conditions, or live with somebody who are, for whatever reason, not yet comfortable doing that?
Yeah, as you know, right now we have an exemption for them. Certainly people over the age of 65, people living with somebody there. Wow, this is happening.
So they wouldn't be able to get the $600 if the $600 is extended, and they presumably wouldn't be able to get that $450 if that is tied to actual work.
No, but if they're older, they're getting Social Security. There are a lot of other ways we'll be able to hold a lifeline. I'll be able to work out those specific situations. What we're really trying to do now is do everything we can to get people back to work safely. That's how our economy gets back, and that's how our people get back.
The Labor and Insurance Committee had a lengthy hearing yesterday, heard from invited analysts, including workers who've been denied workers' comp coverage for claims relating to COVID on the job. What's your thoughts? Should Connecticut revise its workers' compensation law to add a presumption for COVID-19?
I think the state should be generous when people make a claim and they think perhaps they caught COVID at the workplace. I think our state should be generous in looking at that and giving them the protection they need, the coverage they need, the workman's comp that they need, and I hope we lead by example around the rest of the state.
So you would be open to adding a presumption for COVID-19 or other communicable diseases?
No, I didn't say that. What I did say was I'd like to see our state err on the side of generosity. There's a lot of questions about COVID, how it's picked up, where it's picked up. Did you pick it up at the office? Did you pick it up at the protest? But I think for our frontline workers here in the state, I think we err on the side of generosity there.
The Workers' Compensation Commission and several other analysts also raised concern that if Connecticut were to adopt such a mandate, that it might lead to companies and insurance companies that are now covering these claims without prejudice or voluntarily. I'm getting the term wrong, the workers' comp law, but basically that people who are getting covered now would lose that because becoming abandoned. Is that a concern at all for you?
I got to look into that.
Okay.
I think that's legislative.
rules for reopening, now 95%. Yesterday, Jim was shut down in Cromwell by the health department. They weren't following that. I don't know if it's intentional, maybe they didn't understand what was needed. How important is that the municipality, it's their responsibility, right? That they know what needs to be done as businesses now are reopening.
Yeah, I think our local health departments are on the front line. Generally it's a customer, Sue, who says, I see your cashier is not wearing the mask. I think they should be wearing the mask. Otherwise, they notify us on 211. Maybe we get the local health department out there. I'm not looking to close anybody down. I'm trying to give them a friendly reminder. Every 2 weeks we're opening things up a little bit, subject to things working out.
Do you expect to see sort of more, active defiance? I know we talked about this before about people who just, think that this is all overblown or the orders went too far. Do you think there's people out there?
Connecticut's been pretty good, I got to tell you. Connecticut knows we've taken a thoughtful way of doing this. We're opening things up, frankly, earlier than most of our neighbors. We're doing it safely, and I think customers and employees know we have their health first. Hey, thanks, everybody.